Good afternoon and welcome to today's webinar titled Accurate Information is Vital, How Digital Paper is Optimizing the Digital Transformation Process, presented by Healthcare Innovation. My name is Rajiv Leventhal. I'm the Managing Editor at Healthcare Innovation. Today's program is sponsored by eink and Signage. Thank you to our sponsors and to our audience for giving us your time and attention today. Before we get started, we do have a few housekeeping details to go over. First, to submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program to submit one. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue through the Q&A panel. Finally, we encourage you to join our discussion on Twitter today during the webinar, and you can do that by tweeting using the hashtag HILiveWebinar. At this time, I would like to introduce our expert speakers for today's program. First, we have J.Q. Shi, who is a Strategic Partnership Manager at eink. In his role, J.Q. is responsible for the U.S. healthcare market business development and strategic partnership formation. We also have with us today Stefano Diaz, who's the Director of Business Development at Signage, and that's a company that's dedicated to creating tailored smart communication solutions to enhance operational workflows, engagement, and experiences for large medical organizations and their people. JQ and Stefano, the floor is yours.
Thank you, Rajiv. Really appreciate it. Thank you all for joining us today for this educational webinar. So you know the technologies you're about to see exist and are available for you. These solutions will excite you and your executive colleagues, so please do not hesitate to reach out to us or eink for a complimentary discovery meeting. So to talk a little bit about the industry status, healthcare lags in digital transformation. Okay, out of all the industries, healthcare firms typically lag about a decade behind in adopting business technologies that help with customer engagement. The purpose of this webinar is to show available solutions that help reduce miscommunication errors and increase patient satisfaction. As you know, you have most facilities are filled with these boards, whiteboards, printed papers, and it's a clutter and a mess. It's dangerous and stressful. The Johns Hopkins study in 2016 stated more than 200,000 deaths a year are caused by medical errors. There was a later study conducted by the American College of Chest Physicians that stated 60 to 70% of preventable medical deaths were caused by communication errors. Lastly, readmissions is one of the most costly episodes to treat, with hospital costs reaching $41.3 billion for patient readmissions within 30 days of discharge, meaning on average, each hospital loses $1.3 million a year due to readmissions. This was a study conducted by the Agency of Healthcare Research and Quality. Now, if you are a facility with multiple hospitals, you can just multiply the number. So we're going to start off with a little poll here today, and we'd like everyone to engage with these as much as possible. So do you see the need for digital transformation in your hospital? Either A, yes, there is a large opportunity to improve operational workflows and overall healthcare experience by leveraging digital technologies. No, we don't believe technology will make us better, or you're not sure why you're on this webinar and you're just on Facebook and ended up here. We'll give you a couple, like 20, 30 seconds to answer, and we will continue. All right, 5 more seconds. Let's see, get some final responses in. All right. 90% thinks there is a large opportunity to improve operational workflows. So you're in the right place. Hand it off to JQ here.
Thank you, Stefano. Hi, everyone. This is JQ from eink Corporation. If I ask everyone that whether you know eink, I guess probably most of you will say no. But if I ask you that whether you know Amazon Kindle device, I guess most of you will say yes. So eink is a sole provider of digital paper screen on the market, and Amazon Kindle device use our digital paper screen. Different from the traditional LCD screen that you can find on your laptop or TV, digital paper screen is a refractive display, which means it doesn't emit any light. So it has a traditional paper-like looking and is easy on eyes and friendly to the users. It has superior outdoor readability under sunlight or in the bright environment. In addition, its power consumption is extremely low as a digital device. Digital paper can contribute unique values to the healthcare applications. As a digital device, it has all the benefits that a digital display should have. For example, seamless integration with EMR or EHR system. As a refractive display, digital paper doesn't generate any light pollution because it doesn't emit any light by itself. So it doesn't cause any blue light hazard. Imagine used inside a patient room. It will not have any negative impact on patient sleep or rest, which is important. Its typical power consumption is about 3% or less than 3% compared with its LCD counterpart. So it can significantly save operational costs for the hospitals if there's a larger scale installation of digital solutions using digital paper screens. Another attractive feature of our digital paper is it's always on. The content on the digital paper stays on even you disconnect the powers. So in the power outage, the content of digital paper will stay on to support urgent communication in that scenario. In a normal operation, the digital paper has the contents always on and automatically managed by EMR EHR system. In that way, the clinicians don't need to worry about the management of the device on and off, so that they can spend more time for the patient care, which is what they like to do, and this is also what they should do. So overall, digital paper provide additional option beside LCD screen to the digital solutions, healthcare digital solution, I should say. So you can choose either digital paper screen or LCD screen for your digital solution, depends on value that your application is looking for. Next, it will come to another poll question. I will give it back to Stefano.
Thank you, JQ. So, poll question number 2. Do you think that just purchasing a display means your digital transformation is complete? Yes, I installed an Apple TV, so that makes me smart. Yes, the pretty pictures of my dog makes our facility state-of-the-art. Or no, I need to learn how departments can seamlessly update content to designated displays while corporate can push messages enterprise-wide. Also, how can we make the display smart? What if there's a fire? Can the display tell me which way to go? We'll give you another 30 seconds to answer that question before we show the results. All right. 92% said no. I need to learn how departments can seamlessly update content to designated displays. All right. So we got a good group of people here. The Apple TV, I mean, you can do AirPlay. That does help, but you can get hacked real quick. So we'll take care of that later. So let's dive into digital system integrations, okay? System integrations is what makes a space smart, okay? So system integration is the stepping stone towards a smart space as it fetches and feeds communication platforms with the information people need when they need it, okay? And keeping content relevant, up to date, always active with with news. It can be social media. It can be Cerner or Epic, patient information. It could be Kronos, Salesforce, Oracle. I mean, it could be anything catered for employees. It can be for patients, visitors, staff, anything, right? So to make a facility smart, you need to have integrated third-party systems. That's the only way to maximize your daily operational workflows, okay? So to quickly talk about what Signage does, okay, Signage is a system integration company that specializes in digital communication for the physical space. Our network of engineers and software developers build tailored solutions designed around the client needs, whether it's signage, system integration, mobile apps, or even smart robots. Okay, we have many different applications that fit this criteria. Yes, digital transformation is a very broad term, and there's a lot of back-end digital transformations that need to happen to make a healthcare facility smart and up to date. But we're talking about the digital transformation of the physical space. Okay, Signage continues to partner with the largest hardware and software manufacturers around the globe, like eink, for example, to bring these opportunities to our clients so they have access to the latest and greatest technologies for their facilities. Okay, and like Rajiv said, our mission is to help large organizations implement unique digital solutions to create positive experiences that enhance communication and productivity. Yes, we do LCD. We love LCD. We think LCD is great, but everything has its place. LCD is wonderful to play videos, to have interactive, engaging experiences. Like, for example, here, this is a donor wall. Okay, people can go up to it. You see videos and pictures of donor wall of the donors, and you can engage with them, and you can donate right then and there. And there's a lot of graphically demanding content that needs LCD. But today we're talking about e-paper. Okay, e-paper is mainly for highly important operational communication. It's for communication that needs to be up to date and available throughout the facility at any time, whether there's a power outage or not. And yes, I know you got healthcare facilities typically have generators that, if the power goes out, you'll be back up and running in no time. But those 5 minutes that it takes a computer and an LCD screen to boot up, those 5 minutes make a big difference. When you're talking e-ink, that never goes down. The latest information stays on the screen whether there's power or not. So today, we talk about e-paper. The hot topic right now for the e-paper displays or the e-ink displays is patient room displays, okay? So we have for the digital whiteboard on the inside of the room and for the room sign in the front, all right? So both are feeding the same kind of information, but obviously in the front, we can't display patient-specific information. The screen in the front is designed to get rid of the magnets, the posters, the little flyers that are posted on the wall, and you have to constantly check and double check before entering to make sure that the patient is receiving the right care, if that information is up to date, and that the physician comes in prepared for the encounter with the patient. On the inside of the room, you have more of a patient-specific information, like their daily goals, when their next appointment is, how they're feeling, what medications are they on, when were they diagnosed, when was their last treatment. All that information will be available on the inside of the display. The inside of the room also is a touch screen. So if family members are visiting the patient and for some reason the patient is sleeping, they can leave little love messages or little memos saying, hey, went to the cafeteria, I'll be right back. Another thing that's amazing is that I personally could never read a doctor's handwriting. Even though they can try to make it very neat, I could never read it. This definitely makes it easier to understand for the patient and the visitors to read what the status of the loved one is and when the next treatment is occurring. So we're going to mention a couple testimonial and an additional U.S. deployment. Mind you, this technology is deployed around the globe, but it's necessarily new to the U.S. market. Outside of the patient room, we have a case study in landmark hospitals, which is, there's a quote here. It says, one of the ways the nursing staff finds the patient displays time saving is when the call bell goes on for a patient not assigned to them. The staff can instantly see the patient's name, nurse, and why the patient is there. So it saves a lot of time to know who's the patient, why are they ringing, what do they need, what kind of symptoms are they having. They get the information right away, which is great. Currently, we're doing a pilot project inside the patient rooms in Brigham Health and Women's Hospital, which is a pilot project currently being tested for the whiteboard patient communications, which will be used to assist the communication between patients and clinicians to improve the overall patient experience. Okay, everything here is tying into the patient experience and the patient satisfaction, because the easier it is for communication between patient and clinician, and then clinician and clinician, that communication makes a less stressful environment for patients to really know that they're in good hands, that know that the doctor knows what's going on, and everything's up to date. So we're jumping into another poll question here. Have discussions begun in your facilities about direct EHR and EMR integrations for your patient rooms? Yes, you have an implemented solution and are very happy with it. Yes, but the company promised a solution and has not delivered. In other words, a bad experience with another company. Yes, we're actively looking for a solution. No, this is the first time learning of this technology and would like to learn more. Or no, our facility likes to do things the old-fashioned paper way. We'll give you another 30 seconds to answer these questions, and we will show the results. Keep in mind, for all the questions that are being submitted, we have a Q&A at the end, which we will dive in and answer all your questions. So we're not ignoring your questions. We're just going to answer them at the end. Let's see, 10 more seconds, and we will move on. All right. So we see a lot of you, this is the first time learning of this technology. So that's great news. There's a lot to learn, and it's a great solution. And we can dive in and learn about your facilities and learn more about how we can work together to implement the solutions and make it a great experience. We also see that some people have had bad experiences with companies. I'm not going to say any names, but we've heard a few of those cases, and we probably can guess who the company is. So let's keep rocking and rolling. So aside from the patient room, now we're going to take a step outside of the patient room. And we're going to talk about additional operational opportunities where the digital paper makes sense. All right? First off, we're going to dive into nursing stations, okay? These are basically your tracking boards. Nursing stations have tracking boards, patient flow charts that are all either fetched from Cerner or Epic for them to know what patients are are going out today, how many patients are coming in today, what upcoming treatments, what patients are in treatment. So all that information can be fetched and shown on these displays. Mind you, a lot of the technology is the same as a normal LCD. Just these don't play videos, and they're black and white. Some of these technologies have red, but the black and white is really or grayscale is really the most prominent for this type of stuff. These, again, 42-inch displays, you put these in the nursing station. And it's, again, always accessible. Even if the power goes out, the data is always up to date. So it's a great solution for nursing stations. Normal billboards, okay? Yes, a lot of the billboards that you see nowadays in hospitals are the marketing channel, playing videos about their practices, about the additional services, about outpatient centers, educating the audience of additional services that hospital brings. Now, you always have that kind of communication. Unfortunately, right now in these tough times during COVID, we have to remind people to wear masks, to remain 6 feet. So rather than having those posters and banners up around everywhere, you can have these displays showcasing that. Again, no videos, but basic text and pictures. These work great. An additional use case are directories. Directories are very important. And if the power goes out, once again, I keep referring to that because it's a big problem. It does happen. When power goes out, it takes about 3 to 5 minutes for a normal computer to reboot and show the content again. If the power goes out and people don't know where to go, it kind of creates chaos. So this is a great application with eink as well to use these displays for directories. Currently, a lot of outpatient centers are having to put pricing, publicly show pricing in their facilities. That instead of having a big banner with a bunch of pricing in different languages, you can have your pricing on the e-ink display. These displays are great for that because, again, mind you, the power consumption is minimal, okay? Some of these panels, the smaller ones, are battery operated and Wi-Fi. All right, these 42-inch panels are PoE, so powered over Ethernet, so it's one cable that powers them up, and they, again, don't turn off. So this is another great application, pricing boards. On the same note, patient rights. There's always, legally have to have a posted patient rights poster in your facilities. I believe it's in every waiting area. You have to have a patient rights board. So this allows you to have the digital aspect of that. So you're being compliant, and you can add like QR codes, for example, where people can go up with their phone, scan it, and have a direct link to the patient rights. So you don't have an excess amount of print in your facility. You have donor recognition as well. These are for areas that you don't need an interactive video wall or an interactive display to really engage with people. These are kind of one-offs. Like, for example, if a donor is sponsoring a room, you could have a little screen on the outside, which can be, for example, the patient room display. And when the screen is on idle, you can show a donor recognition. So it has multiple uses, which is the beauty of digital. You could also use them for conference rooms. And conference rooms to have scheduled events, to schedule meeting times. So for people inside the conference room to know what's coming up next, as well, you can put it outside of the conference room. So you can book a room, you can book it through your phone, you can book it right then and there with the system. So it's a great tool to have in these situations. Also, when if there's a fire, okay, and the reason why it's about creating a smart space is that if there's a fire, all right, these technologies should tell you where to go. Because what if the fire is actually in the route that it's telling you to go? That's not smart, right? So it's about creating smart content and smart integrations so that the content is constantly refreshed with up-to-date, real-time data, hard data that makes the content trigger to either a playlist or directions to keep people safe and to guide people where you want them to go. An additional operational opportunities that everything's going mobile, okay? The mobile experience. Now, yes, you have email and you have QR codes. Technically, that is involving mobile. But when we talk mobile, we're talking about a healthcare patient-focused app, all right? This application is not just wayfinding, because wayfinding is great. Wayfinding is wonderful. But once you're there a couple times, you know where you need to go. So you shouldn't be investing all this money and infrastructure on an app that just does wayfinding, because that becomes obsolete. A lot of these healthcare facilities are creating 4, 5, even I've seen up to 6 different apps from one healthcare facility, all to do different tasks. And as a user, that takes up a lot of my storage. I don't want to have all that memory dedicated and devoted to a healthcare system. Healthcare facilities need to have one application that connects both the wayfinding and the overall healthcare experience for patients, visitors, and staff. For example, you have easy on-the-go medical records. You have appointment setting. You have visitation registration, and even drug interaction checkers. Okay, it's about increasing the value and the need of a healthcare platform that people can trust. It's their go-to for healthcare. Mind you, all these displays and the e-ink displays can be integrated with beacons. So as you're walking by, okay, and you have this mobile platform in your phone, it's about location intelligence. So for example, if you're walking by, you're running late to a meeting and or to the appointment, and you're going into and you walk the wrong way for some reason because you weren't using the wayfinding on your phone, we know that your appointment is on the other side of the hospital. We can trigger messages on the e-ink display to say, your appointment is behind you. Is in room 302, which is on the west wing. You are currently on the east wing. You can trigger messages based on if there's, for example, a code blue, which is a non-responsive patient, okay? You can trigger job assignments for your employees, saying if it's on the 3rd floor east wing, you have, and there's a non-responsive patient, you can trigger the code blue team that is in that area immediately to go to that room and solve whatever issue is happening. Okay, mind you, this app has over 50 features. No facility has all 50 features right now, but we have over 35 facilities around the globe using this application to its extent. Mind you, you have outdoor to indoor wayfinding, you have pill reminders, you have symptom checkers, and the appointment scheduler, right? That's something that's important to reduce no-shows. If you know, again, it's location intelligence. If you know a patient is running late, okay, because of Google traffic and Google Maps, and you can tell that they're on the other side of the city and there's a lot of traffic and their ETA is going to be 30 minutes past their appointment, you can either A, suggest them a different appointment time, B, you can reshuffle your schedule. So if there's a patient that has arrived earlier, is arriving earlier, you can send them a message and say, hey, your appointment has been moved up. You can take this earlier appointment. Would you like that? Or would you accept it? So on and so forth. So it's about location intelligence, knowing where people are and how to communicate them, and having a platform as a healthcare institution, for my people to trust and rely on. Mind you, you have also like telemedicine integration. So if you have a telemedicine platform that you're currently using, this system is completely modular. We can get that system and integrate it easily. So there's a lot. This alone is a very long conversation on this app itself. So I'm going to jump to the next slide, but feel free to contact us and e-ink, as we have a lot of information on this, and I'm sure you guys are going to like and grow. So how do you update content on all these displays, right? So aside from system integration, which is fetching data from third-party sources, also you have the site communicators. They have access to the screens on their facility, okay? While there's also a hierarchy. You have corporate that can also broadcast messages enterprise-wide or regionally, depending on what message it is and how they want to communicate it and to who. You know, the opportunities are endless there. because you have a communication platform that you can broadcast messages at the click of a button. All this technology is generating data and analytics. What do you use this data for? Well, that's up to you. You can tell where people are, where people typically congregate. When it comes to redesigning a facility or conference rooms, you can see what conference rooms are being used, which ones are not. So it's about using this data not only for COVID tracing and demographics and traffic patterns, but also for evidence-based design. So for future renovations, all this data and analytics will be extremely useful for you. Jumping into another poll question. Would you like to schedule a private meeting to evaluate which of these technologies best fit you? First one is yes, we want a system integration specialist to guide us down the right path to maximize the digital transformation investment we need to make. Or no, we think we can do it ourselves, but I will keep your contact info for when we hit a rock and find out we wasted a bunch of money, time, and resources doing it wrong. We'll give you 30 seconds to answer that. All right, let's see the responses. Nice. Most of you think you can do it yourselves. Love it. We'll be in contact in the future. What's funny is that a lot of times, we see this a lot, and IT tries to take care of it itself, and we have nothing against IT. We love IT. We love marketing. We love executives. We work with them all the time. A lot of the times we see that IT tries to do it themselves, and, we find out that down the line, they've either wasted millions of dollars, either takes years, and I'm talking 3 years, to deploy some of these technologies. A lot of these technologies we're talking about can be deployed within 3 months, all of it. Every single thing I've mentioned can be deployed within 3 to 6 months. So it's about saving time, too. If you want to contact us directly, Signage, you can scan this QR code, and it'll take you to the contact page on our website. And we have the website below, and an email if you want to send us an email directly. We're going to jump into the Q&A right now, but before we do that, we do have a special promotion on this, and eink is actually doing a free loaner program, risk-free loaner program, which allows you to try the device and a demo software for free for a trial period. JQ, would you like to elaborate a little more on this?
Yes, sorry, I'm muted. Yes, happy to do that. So we offer, together with partners, we offer this loaner program to both of the hospitals and also the system integrator, if there's any. There are 2 devices covered by this loaner program. One is a 42 larger screen. It's an e-paper larger screen, typically used as a billboard, communication board, whiteboard, for example. Another one is a 7.8 inch. It's a door sign type of display. It's battery-based. So we typically provide a couple of months for integration purpose, for engineer testing purpose. If you're interested, please send us an email at partnership@eink.com, or you can scan me there, lead you to the website, and you'll find more details over there.
All right. So let's jump into the Q&A. We see we got some questions here. All right. So number 1 is, can I customize the screen layout? So yes, all content is completely customizable, and it's basically designed from your branding guidelines. Every marketing department has branding guidelines that need to be met. So we build templates for your content management system so your people can easily update messages. that still fall under your content guidelines. Mind you, we can also have a pre-authorization step that way if someone's updating content, the executive team or marketing team can pre-approve the message before going live, okay? Which is important because if someone gets fired, you don't want them to be able to upload content that may not be according to your branding guidelines, to say it in a nice way. The next question is for JQ. JQ, for your loaner program, what hardware infrastructure or system do I need to use your devices? Will you provide installation and technical support?
The installation hardware accessories is included in the devices. For example, 42-inch device, it has a bracket come with it. You don't need to buy a commercial bracket on the market. The device, compared to the LCD displays, the 42 e-paper screen is much lighter, so the bracket can support a lightweight screen, and you can mount it to any space. You need to find a space and mount it. For the small one, it comes with a bracket as well. If you want, you can also prepare this magnet sheet so that you can mount this device on any surface. There are two options in terms of IT connections. You can use a wall receptacle with Wi-Fi, which already comes with the device, or you can also use a PoE. In that case, we will recommend you a PoE splitter, then you need to prepare a PoE splitter. Otherwise, you don't really need other infrastructures. Basically, find a space and a mount.
All right. Third question. So how does the mobile app communicate with eink screens? So with Beacon technology, we can trigger content on any display, whether it's eink or LCD, to trigger content based on whoever's in front of it, as long as they have the mobile app. Thanks to the wayfinding infrastructure of location intelligence, with beacons and access points and Wi-Fi routers, we can know where people are to a 1 to 2 meter range. It's fairly close. So that means we can trigger content in front on the display based on who's in front. For example, if a large donor walks into a hospital and you can tell, and you know that the donor just walked in, you can trigger a thank you message for that donor on the welcome wall or on a welcoming screen, whether it's an e-ink panel or an LCD panel. Question number 4, are these devices waterproof? How do people clean them in hospitals? Very good question. So that's a two-parted question. So are these devices waterproof? Well, some of these digital displays, if it's directly outdoor, where you get direct rain, direct sunlight, humidity, hail, snow, no, you need to have an enclosure on it, okay? You need to have some kind of protection so the components in the back that drive the displays don't get ruined or oxidated, okay? But generally speaking, you can, if it's semi-outdoor, you can get away with it. We don't recommend it. It voids the warranty. If it's an indoor display, it will void the warranty. You can do it. We've seen it happen hundreds of times, and it still works, but you just can't claim warranty. There's specific units for outdoor. And how do you clean them in hospitals? Well, we use a few different methods, because obviously a normal Windex does not work, and that actually ruins the technology. A couple of different ways we use, we keep the screens clean are through this antibacterial film that we put on the displays. And you can also, there's a specific cleaning solution that we have that we can do. You can just clean the displays as if it was a Windex. Number 5.
I would also emphasize. I would also emphasize that those devices, the surface, has a medical grade surface, so you can use a general sterilization process way to clean it in the hospital facility.
Thank you, JQ. Yep, I forgot about that one. Thank you so much. So moving on, number 5, who will provide the mobile app? Can the mobile app be white labeled? Can we design our own mobile app? So yes, I'm not going to answer in order. Well, I can answer in order. Who will provide the mobile app? Signage will provide the mobile app. Can the mobile app be white labeled? Absolutely. It can be completely white labeled. You will not see any of our logos anywhere. And can we design your own mobile app? Well, we would ideally work together to design the mobile app for the ultimate user experience. Question number 6, can I display a black and white PowerPoint presentation or an Outlook calendar? Yes, you can. I'm assuming this question is for the e-ink displays. Yes, you can. You can show any content you want as long as it's not a video or very colorful. If it's colored, it's going to be shown in a grayscale, so it won't look the way you think it's going to look. Question number 7, which content management solution is behind the e-ink? That's a great question. Well, there's many answers to that question, actually, because we don't use just one content manager, because what's feeding the e-ink displays is actually Cerner and Epic. We just fetching the data based on the infrastructure that the healthcare entity has. We try not to reinvent the wheel, especially healthcare facilities have invested a lot of money on infrastructure for how things are connected. We don't want to come in and say, oh, we got to rip everything off the walls. Like, no, everything is tailored to the infrastructure that the facility has. So we have many ways to getting content on the e-ink. Number 8, so how are these devices connected to the EHR and EMR system? Can they connect to internet? So yes, they can connect to the internet. We want everything to be connected to the internet because that's the easiest way to have the most up-to-date information. The internet should be secured, and sometimes it's on its own server. So pretty much through APIs, we tie into Cerner and Epic and fetch the data, and based on patients typically have a number, like their ID number, and that we just match the room with the ID numbers and fetch that data that way. So you have the content, the patient room is always showing up-to-date information on the patient that is actually there. Mind you, there is obviously some human intervention where whoever is the patient management of what patient is going where, they need to update a file, which then that file we will extract that information from and update the content on those boards at the right time. Good question. See if we have any more questions here. I don't think we have any more questions. Well, thank you all. I'm going to put here one more time, the e-ink free loaner program, free fill scan, and send an email to them if you want to find out more about the e-ink loaner program. And if you want to get in contact with us, Either way, we work as a team, both eink and us, so it doesn't matter which way you want to go. We're still going to work together, and you're going to get the whole package. So you can contact us directly and to find out more about how we can work together and what solutions best fit your facility, as well as go back to the eink loaner program if you want to find out more and see how these technologies work for your facility. I want to thank everyone for making the time to join us today. I hope this webinar was educational and engaging and entertaining for all of you. I had a great time presenting, and we look forward to helping all of you grow your healthcare facilities and get a step ahead in the digital transformation process.
Great, and just to echo those thoughts, I'd like to once again thank JQ and Stefano for making today's webinar excellent and informative as it was. I'd like to thank our sponsors, eink and Signage, for making the program possible. And of course, we'd like to thank everyone in our audience for joining us today. We really hope you'll join us in the future for another healthcare innovation webinar. And with that, this concludes today's presentation.